the 10 level map
Wow.
to pass the NCLEX exam. Right. Now, so level one is what I call foundational readiness. Level one.
Okay, level one.
Yeah, is what I
Fun.
call foundational readiness.
Okay.
Right. This is your foundational readiness. Now, foundational readiness is this. It's just like now, take for instance, you are going to a music concert.
Mm-hmm.
Right. A music concert. Now, the concert is in 2 weeks, but you bought your tickets today. What does that mean? It automatically confirms that even if the concert is in 2 weeks, you already confirm to yourself that you are attending that concert by buying that ticket.
Yeah.
So, what it means is that you will do everything possible that when it's in 2 weeks' time, you are able to make it to that concert. Anytime you think of, oh, I'm not sure I want to go to the concert, you will remember that, oh, I spent $200 to buy this ticket. I don't want to waste this money, right? That is
Yeah.
how you will be thinking because you have committed something, right, to make sure that you're able to attend this concert, right? You bought your ticket and agreeing with yourself that you are going to make it to this concert in 2 weeks. That is the same thing that apply to the NCLEX when we talk about foundational readiness. We have two types of readiness. We have exam readiness and foundational readiness.
Okay.
Right. Now, this foundational readiness for the NCLEX is in two ways. Is either you decide to fix your exam date or you decide to just have an exam date in mind.
Okay.
Right. Is either you already scheduled it or you just have it in mind. One of these must be completed in this level. Right,
Okay.
because that is what we are going to use in order to know like we are just going to have that in mind and we are preparing alongside with that. That's your foundational readiness. If you have
Mm.
scheduled your dates from now till your test date, you will not joke around. You are going to be very serious because you know that you need to pass. You know there's a
Okay.
date, you know there's no time. So every time you think of not wanting to do something, procrastinating, right, not studying, this test date, you will always remember it that, oh my God, I have scheduled my date. I don't think I can joke around. Right. Now,
Mm.
even the dates that you want to take the exam means that you already commit yourself to what readiness. It means that you are telling yourself, okay, by January 29, I'm definitely going to be ready. You are telling yourself now that by January 29, I'll be ready to what take the exam. So that's like your foundational readiness. You are ready even right from the start.
Okay.
Right. So that's foundational readiness. So I love to complete this level with the students, making sure that they have a set date because that is how um I let me just say it's something I want to make sure that students is really serious about what they are doing. In the past, I have had students say, oh, don't worry, coach, I still have time. Coach, I still have time. 1 year they have not taken the exam. I have a particular student who joined my coaching program that was last year August, right? That was last year August. Now, this year August, right? She has not taken the exam. And this is uh December 29. See, now I see to find that because our time together long um expired because it's a 60-day coaching program, right? Now, but
Mm.
December 29, I see to find out from our friend, right? Have your friend taking the exam? He say, I'm not sure. She did not tell me anything about the exam. But what I noticed about this lady is that when we're in the program together, she always used to tell me, "Oh, coach, we still have time. Coach, we still have time. I still have time." No, not even we still have time. She always used to say, "She have time. I still have time. I'm not in a rush. I still have time." You see, if Adibishi has fixed a date, she will not be thinking she still have time.
Yeah.
Unknowing to this lady, she don't know that she's not only wasting time, but she's wasting opportunity. Now, a friend started August 19. She joined around 24th of August. A friend ended up finishing the 60-day program, took her exam December 17, and 19 called me, told me that she passed the exam. Now, 1 year later, the friend now has not taken the exam. Now, this person got her first nursing job in January. Currently, as I speak, she currently have two nursing job. Even thinking of even leaving one for another. Like she just have countless options. But this person has not taken her exam yet. Now, I still have time. I still have time. She don't know she's wasting not just time, but opportunity because the same way this person passed the exam, the same way she could have passed and could have started living her dream as a licensed nurse. But because of procrastination, I still have time, I still have time, I still have time. Right. She have missed all this opportunity. Right. She could have easily be making equally 5K plus monthly salary for the 12-month plus that she has wasted. So when she's thinking, I still have time, I still have time, what she has just simply done to herself, if she truly wants to become a nurse, is that she has wasted the opportunity to have passed the exam and made over $60,000 worth of nursing salary. So many people think they are paying with time, but unknowingly to them, they are paying with money that they could have made, right? When they should have made the right decision. So I won't fix all these things. I don't want students to join my program in a way they don't want to like take the exam. So that's why this foundational readiness is there. I need students that are ready to pass the exam. So that's the level one. What we need to do is to like, you know, have a set date. Either you've scheduled it already or you just have the date in mind and we can work together with that date. Right. So that is for level one. Now I will talk about um level two. Now level two, hold on. Now level two is um what I call starting point. That's level 2. This is what I call starting point. Now, the moment a particular student decided that they want to, like, let me say, start preparing for the NCLEX exam, they are always between these things. I've seen it over and over again. You see students saying, "Oh, coach, I don't know. I've really been thinking about this. Do you think it's content I need to start with? Do you think I need to get a particular question bank in order to prepare first? Or maybe I just need to master test taking strategy?" Students are always in between this. Many times, 80% of the time, this is where they end up starting from. But at the end of the day, I see this 80% of students, when they start having problem with answering question, they start blaming it on this. So they start diverting down here. When they are not still able to use that content to answer the question, they start thinking a strategy. They also come back and divert right here. So their whole NCLEX preparation is like a mess. So they are jumping from one thing to another thing, back to the same thing, which when they do this, their problem is not yet solved. They start thinking of the next resources to get, or like they are saying, "Oh, what program are you using?" "Oh, I am using this program." They start moving from this particular program to another program. Now, not only I've seen this with students that come to me that they want to join my coaching program, I've also seen this on a particular Facebook group. This Facebook group belongs to bootcamp, right? The bootcamp NCLEX program, right? Their Facebook group. Many people have access to posting in this group, and you see many students posting, "Oh, I don't know what to do again. I've been using this question bank, but my score is always between the 50, 70. Some will say between the 50, 60. I don't know." And I see some people having 80 plus, and I don't know why I am stuck here. Will I be able to pass this and that? What do I need to do? Now, somebody might now come in the comment section and now post and say, "Oh, you just need to just know your test taking strategy, this and that." Now, she's now getting option on what to do. Now, somebody might not say, "Yes, this is what I did. I was able to pass." Now, the same person now that posted this will reach out to this person and say, "Okay, what other program did you use? Is it only bootcamp you use?" Now, that person will not say, "I use bootcamp, I use Asha, I use this." Now, because that person that posted this already noticed that this person passed, it gives this person the ability to now listen to how this person passed, and then they are like, "Okay, I use bootcamp now, then it means I'm going to go get Asha." Maybe they use Mark K as well too. They will say they want to go get Mark K. So now this person automatically will not only use bootcamp now, will go get the Asha program and the Mark K program. So they tend to like have different resources, confusion, problem. Like I always used to tell my students that the NCLEX word, right, is very noisy. If you pay attention to it, you will be distracted. Now, the reason why all this right here that I listed happen is because of the confusion that happened right from the starting point. A lot of students don't know how to start or where to start. They don't know where to start. It's just like right now, if you are trying to like cook a particular meal, your starting point is to get your ingredients. That's your starting point. Once you have the ingredients, you can be able to start cooking. All you just need to ask yourself is, which ingredient am I putting in the pot first? So if students are worried so much about all this, then it means they don't even know the ingredients they need in order to start with and pass the exam. So that's what I do. I help students fix at this point, right? Your starting points all come from the NCLEX ingredient. What make up any exam? And it's not even something that is only related to the NCLEX. It's related to any exam. You need to ask yourself, instead of asking, what do you need to start with, all that kind of stuff, ask yourself, what make up any exam. When you were in nursing school and then you had your med search exam, were you confused like this? No, because you know where to start. When your lecturer is saying, oh, students, we have med search exam, and you are like, oh, our exam is next week, what did you do? All you just did was to go back to your med search slide, you study the content. You look for questions to practice. You were not lost. All you were just worried about is to see if you are like retaining the information. So when you end up taking the exam, right, you're able to select the correct answer and pass the exam. That's only your what you were worried about. Right. The same approach that apply to every exam apply to the NCLEX as well too. And there are three ingredients you need as your starting point, which is one, you need an understanding of that particular exam. Two, you need to know the content related to that exam. And three, you need some level of practice question related to that exam. So if you understand that you are taking med search exam, you are not going to go and study pharmacology content, right, for med search. You will fail, right? Because the understanding of message is different from pharmacology. Message is related to condition, pharmacology is related to medication. They are not the same. So your understanding will make you say, oh, if I'm studying for message, pharmacology content is not what I need. The content, same thing. What contents are related to message? These are disease conditions. What content are related to pharmacology? Medications. You know the content. And when you are practicing question, you are not going to practice pharmacology question for med search. You will fail because pharmacology question is not med search question. So the understanding open way for you to have the right content and practice the right question. So this is your starting point. It applies to every exam. So what exam are you doing now? The NCLEX. All you just need to have is an understanding of the NCLEX, know the content that will be tested on the NCLEX, and practice question related to the NCLEX. Now, in nursing school, we have two, no, in nursing, we have two exams, right? In nursing, we have two exams. We have your nursing school exam, and you have your NCLEX exam, right? So the understanding of nursing school exam is different from the understanding of NCLEX exam. Nursing school exam is to test recall, NCLEX exam is to test care. So this same understanding you're having for nursing school exam is not what you're going to use for NCLEX exam. You will struggle. NCLEX is testing care, nursing school is testing information. So they are not the same thing. So despite the fact they have both nursing contents, they don't test the same way. That's what the NCLEX wants you to know. Like the NCLEX itself is like a mini school on its own that you need to have an understanding about it. And that's the reason why the NCLEX wants you to have an understanding of the exam. That's why they created that document called the NCLEX test plan. So that before you take the exam, you understand everything about the NCLEX. NCLEX is not hiding anything from the student. The NCLEX has given you the understanding. The NCLEX has given you the content that will be tested. The NCLEX has given you sample question that you should see how they test the question. They also even taught how they write the question so that you know. They also even gave you the concepts at which you carry out care so that once you see a particular question, you can instantly identify what concept you are going to apply related to that question. The NCLEX has did everything possible. But you will not know that if you don't have a clear understanding of the exam, know the content to study, or the actual question to practice. So this is your starting point. Having a clear understanding of the NCLEX exam, knowing the content to study, and the question. Right. So that is about the starting point. So now the starting point, there's no more confusion again because I have given you how to go about that starting point. So that's that for the starting point. So I'll put next right now. Let me just clear this on the screen. Right. So now your level 3 is understanding the NCLEX. Now, okay, let me just put this on the screen. Level 3, 4, 5, 6, 7, and 8. They they are all related to these 3 ingredients. Sorry, 3 question. Now, 3 is where you understand the NCLEX. So you want to understand the NCLEX, what the NCLEX is all about. Right, that's 3. So now when you have a clear understanding of the NCLEX, is the understanding of the NCLEX will introduce you to the kind of content you should be studying, the kind of question you should be practicing. So now, after this understanding, you are like in a studying mode now. Because now, all you just need to start doing is to start implementing um, these 2 other level, which is start mastering, understanding the kind of content NCLEX test, and mastering is understanding the kind of question NCLEX test and practicing them. So you are in a study mode, but you cannot just get into it like that. Like I always used to tell my students, if you are trying to like cook a particular meal, you have all your ingredients right now, right? You cannot just put all the ingredients in the pot at a time, right? Or you will not be able to make that food properly. You put the ingredients one at a time. Maybe you start boiling so and so before you put the next one, like that. That is what we do at this point. Your study mode is like, okay, you are ready to cook the meal. Now, how do we now put the ingredients one after the other? That is what we call structure. So your level 4 is your structure, right? Your structure. This is where we implement a particular plan and schedule, right? A particular plan and schedule, right? Remember, we have our foundational readiness already. So this is another thing, like a mini commitment, whereby we tell ourselves, oh, I need to study today, maybe tomorrow, and day after tomorrow. You have a specific time that you want to study. So when you get to that particular time, you know, okay, you are studying today. The time you are going, anytime you want to tell yourself not to study, you are going to remember that, oh, I have a fixed date already. So you will definitely study. It's just like right now, you go to work, you have your schedule, right? Every day or every time you go to work, you tell yourself, oh, I need to go to work today, because obviously you should go to work that day based on your schedule, right? So your schedule is making you to go to work. Same thing, your schedule should make you study. Anytime you remember that, oh, I have a set time for studying today, then you actually should study. Now think about it. If you do not go to work and there's no good explanation about it, you end up what? Losing your job, right? Same thing with the NCLEX. Any day you decide not to study, you end up setting yourself up for failure, right? So we need this structure. It's very important. It make us know what we are doing, right? So that is your level 4. And then the level 5 is now where we start understanding the content, right? We want to understand the kind of content that class wants us to study, because there are 2 types of content. There are content in form of topic, and there are content in form of care. This is more of what you did in nursing school, but this is what NCLEX wants you to do, right? I was explaining the last time to you this particular area. Now I'm going to explain again topic versus care. Now, topic versus care. Now, um, one topic in nursing school is what we call advanced directive, and on the NCLEX exam, NCLEX arbiters integrate advanced directive into the client plan of care. This is the topic. This is a care. You can obviously tell which one is topic and care in the two, right? Because this is just capturing the topic and it's not telling you what you should do about it. But this is telling you what you should do about it, right? It's not more in form of topic, it's not more in form of what they want you, the nurse, to do, which is for you to integrate this advanced directive into the client plan of care. So now what you are going to be asking yourself now is, how do we integrate? There's no question you want to ask yourself here. If somebody tell you advanced directive, there's no question, because all you just want to just do is to just go open a particular book and start reading advanced directive. But this, you start by understanding that, oh, so NCLEX want to test how nurses integrate advanced directive into the client plan of care. Oh, okay. So if I know how to integrate, if I see any question related to integration, I'll be able to answer it. So now you have started even thinking about the kind of question. You already have an idea, the kind of question NCLEX will test. Right here with this topic, you don't even have an idea how the NCLEX will test the question. You will study, but you are not going to have an idea. But this, right from when you are studying, you already have an idea how NCLEX will present the question. So you are not going to go on the NCLEX exam with those kind of anxiety again. You are going to take the NCLEX exam because you already have clarity of what to expect. So that is what the NCLEX want. NCLEX want that when students are taking the NCLEX exam, they are clarified with what to expect. They are not going on the NCLEX exam with surprise. Many students in the past will say, oh, coach, do you know when I was on the exam, I did not really understand what the question was asking. I don't understand the content they are testing. I'm seeing some content that I've never heard of before, something like that. Right. All these problems start from what content are you studying? Are they related to what the NCLEX want you to study? Are you studying it how the NCLEX want you to study? So even if advanced directive is one of the content of the NCLEX exam, are you studying it related to the way NCLEX wants you to study? Because NCLEX is not saying, okay, go and start looking for unnecessary information about advanced directive. NCLEX has positioned you related to what they want to test, which is integrate advanced directive in the plan of care. So when you want to study, you go straight to asking yourself, how do we integrate? And you start learning from there. Right, so that's the difference between topic and care. Right. Another thing, right, when students don't end up studying the way the NCLEX wants them to study, it causes them to always be stuck between two answers, or sometimes think every answer in that particular question seems correct. I hear this a lot. I hear this a lot. Because one thing about the NCLEX is that sometimes every answers seem correct. I find myself getting stuck between two answers many of the time. Right. Now, the reason why you are stuck or you seem every answer have been correct is because you are still studying related to topic and not care. Like care have like a guideline, like a step by step what we are doing. Now, when you apply that care to that NCLEX question, it will be clear what the answer is. It's as simple as that. But because you think about topic, there's no how you can put everything together because everything you are reading them separately. But when you think about care, you are reading them all together. How do we perform medication administration? Is different from studying beta blocker alone. When the NCLEX is saying, how do you administer, testing you question related to administration of beta blocker, you can still be lost in that question. But when you know medication administration, it will guide you how to answer this beta blocker question. Because the key NCLEX is testing is medication administration. But students will ignore this and focus more on this. So when the NCLEX is asking them a particular question, they get lost what the NCLEX is testing. But this is like the guide. Medication administration will tell you need to start with verification, verify the order, verify the client identity. Next, you need to move on to assessment. See why the client need that medication, see why the client don't need the medication. So when you are on the NCLEX exam, and then the NCLEX is saying you are caring for a client, let me put it on the screen. And the NCLEX is saying you are caring for a client, right, who has a blood pressure reading of 160/102, right, and has a history of asthma, and it's asking you which of the following order should you question, and they are giving you beta blocker, they are giving you fluorosimide, right, they are giving you the client bronchodilator, right, and they're also giving you their calcium channel blocker, right, and they're asking you which of this following order should you question, right. Now all this answer will not seem correct to you, because now this is what gets students to say, oh, every answer is correct here, what will be the correct answer? Because when they think about beta blocker, they think about the blood pressure and they are like, oh, this blood pressure is high, so this is a correct medication. When they think about fluorosimide, they say fluorosimide also can be used for hypertension. The blood pressure is high, so this is correct. When they think about bronchodilator, they say the client have asthma, they say it's correct. When they think about calcium channel blocker, they say the client has increased blood pressure, they say it's correct. So now, these students now will be looking at this question saying every answer same correct. So now, the reason why it's correct is because they only focus on the nursing information, not the care. When you think about the care will tell you why this can be wrong or correct, why this can be wrong or correct, why this can be correct or wrong, why this can be correct or wrong. The care will tell you, but nursing information will not tell you, because nursing information is what angle do we give IM medication. Nursing information is always like it's 90-degree. But nursing care will tell you if we should give IM medication or not. So nursing information will not tell you, nursing care will tell you if you should give the IM medication or not. But nursing information will instantly tell you the degree you should go in giving the medication. Right. Nursing information will tell you the degree at which you should give your IV to give your IV or IM medication, but they will not tell you if you should perform that particular care or not. Now, if you want to give IM and possibly the client have risk for bleeding based on based on a particular condition they have, your nursing information will tell you it's right for you to give the medication 90-degree, because the NCLEX will put that kind of answer there. The NCLEX will say, okay, go 90-degree to give this medication. But indirectly, the NCLEX want you to use your nursing thinking to ask yourself, should we really give this medication? Is there a reason we should give it? And is there a reason not to give it? Many of the time, the NCLEX have the reason for you to give it and also the reason not to give it. Now, you might just pay attention to the question and now notice that, oh, this client has a condition that put them at risk for bleeding. No, 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 no. We should not give them IM. It can cause bleeding. But you will see that answer that say go 90-degree. But you now, as a safe nurse, will now say, no, this answer cannot be correct because it's not safe for that patient. It's as simple as that. Same thing that is happening here. They are all reason for you to give all this medication, but the NCLEX is not stupid for asking what should you clarify. So it means that every answer are not correct. You are only paying attention to the nursing information and not to the care. So when you think about the care, when you ask yourself, why should we give this medication? This is the why, and why should we not give it? That's when you remember, okay, this we can give, this we can give, this we can give, but beta blocker we cannot give it. Why? Because it is contraindicated to asthma. So when you think about the care, it makes you explore every information in the question. But when you think about nursing information, you can only just pick on one thing that is correct, and then that's it. And that's what gets a lot of students to fail the exam, right? So you need to understand NCLEX content, which brings us to level 6, which is also understanding the way the NCLEX think, right? I know a lot of students have heard this multiple times. They've heard about this multiple times. You want to be able to think like the NCLEX, think like the NCLEX. What they are simply telling you is not to think like the NCLEX. They are simply telling you to think like a nurse, because the NCLEX want you to think like a nurse. In nursing school, you were not thinking like a nurse. You were thinking like a nursing student. So when they are telling you, oh, when they are telling you, think like the NCLEX, they are simply telling you to think like a nurse. Simple as that. So, yeah. So as a nurse, right, nurse think about care. As a student think about uh memorization, cramming. That's what students think about. Oh, how do I memorize everything that I'm studying related to this slide? But as a nurse, you don't use slides to care for your clients. You use your nursing knowledge to care. So you are thinking, what nursing knowledge do I apply related to this care that I am about to perform? So that is NCLEX. So level 6 is where I help you to refine your nursing way of thinking, because a lot of students, after spending 2 years, 3 years, 4 years in nursing school, they don't even have any special way of thinking than still thinking the way a nursing student think. So the goal of level 6 is to be able to refine, right, this way of thinking, so that you start thinking like the NCLEX. That's where everything will start making sense. That's where your ability to see a particular question, understand the content that question is testing, and be able to like understand what the examiner is asking and what each answers are saying will now start coming into place. Right. So now level 7 is your ability to understand the NCLEX question, right? And be able to practice them adequately. What you want to understand about the NCLEX question is you want to know the kind of question to practice. That's the first thing. Two, you want to know how the NCLEX write the question. The NCLEX want you to know that. When the NCLEX want to write the question, they start by thinking about the 8 client need they will test from. One of the 8 client need they will test from. Now, because this is the foundation of the whole NCLEX, right? This is what the exam is built on. Now, when they pick one client need here, under that client need, they pick the content. When they pick the content, they test you related to a specific concept. And from the concept, that is how they end up writing the question. So to summarize all this, it means that when you see your final NCLEX question, it is testing one client need, one content, one concept. So if you can be able to identify the client need, the content, the concept in that question, you have the ability to answer that question successfully. Right, I'll come back to explain this, but the third one is your ability to break down the question, and the fourth one is your test taking strategy. Right, once you have all this in place, practicing having your right practice, which is practicing the right question, knowing how the NCLEX write the question, having your ability to break down the question, and the right strategy, you'll be able to kill any NCLEX question, right? This part is very crucial. Like I was saying the last time, I said, if all I did when you don't know how to drive a car is to just tell you how to drive it, without not putting it into practice. I just spoke to you and I'm like, oh, when you get into the car, this is what you need to do. Then I took the car to the highway and I'm like, okay, drive. The chance of you crashing is 100% because I only told you about how to drive. You've not put the driving into your driving skill into practice. So the chance of you crashing is high. So if you only rely on content and you go on the NCLEX exam like that, guess what? The chance of you failing is high. You need to practice question, right, in order to know where where you still have like weakness, right? Where you think where you need improvement and all that kind of stuff, so that you can start fixing them before you actually take the exam. So practice question is very good, but you don't just want to practice random question. You want to remove the idea of I need to practice 2,000 questions to be able to pass. I need to practice 3,000 questions. My friend did you what did another friend did Asha, another friend did boot camp, and they all pass. So let me get Asha, get you word, get bootcamp all together so that I have that chance of also passing. So if it is you word that is going to help me, I will pass. If it's Asha, I will pass. If it's bootcamp, I will pass. No, you don't need thousands of questions or multiple questions in order to pass. You need the right question in order to pass. And the right question can just be 300 questions, can just be 400 questions, because NCLEX don't test multiple things. NCLEX tests 6 concepts. So when you are answering 85 questions, you answered 6 questions related to just 6 concepts. When you are answering any question between 86 to 150 questions, it was just related to 6 concepts. So once you can have this clear breakdown, know how the NCLEX write the question, have this clear breakdown, you'll find out that every question are pretty much the same. It's only just testing different content. It's just testing different content. The strategy are pretty much the same because they are related to the concept. What the question is testing are pretty much the same. The only thing is different concepts. When NCLEX want to test COPD, do you know how the NCLEX test every med surg condition? Many students don't know that. When NCLEX want to test a condition, there's a format at which they test every disease condition. Every disease condition fall under that format. But many students don't know that. That's the reason why they don't know what to study when it comes to COPD or any other disease condition like hypertension. They are just studying all over the place, right? So we want to like have the right practice, know the intellect, write the question, have a clear breakdown and strategy. Now back to this 8 client need. Like I was explaining the other time, I said the 8 client need, right, are things that you are going to be doing. There are things you will be fulfilling, the care you'll be fulfilling as a nurse when you start working as a nurse. There are cares you will be fulfilling when you start working as a nurse, right? So they are just the category of cares. Now, when the NCLEX want to like write the exam, or when they started like the NCLEX, what they did was to go into the field of healthcare, right? They went into the field of healthcare to find out what are things that new nurses will do when they become a licensed nurse, so we can test them related to those things and see if they are a safe nurse before they start working as a nurse. So when they did the research, they had a list of all these things that you'll be doing as a nurse. Right. They had this list. Right. Now, so this list of things that you'll be doing as a nurse, they broke this list into the 8 client need. So the first one have a lot of lists, the second one have a lot of lists, the third one have their list, fourth, like that, so on and so forth to the 8 that have their list as well, because they broke all this list into the 8 client need. So they call them the 8 client need. And they also have weight to it, which is how important are these 8 client need, right? So, for the first client need for RN exam is management of care, and they have it 18%. The first one for NCLEXPN is coordinated care, and it's 21%. Meaning, when you are trying to study, you don't just want to study randomly. You want to make sure that you are not covering the areas that is 9%. before you cover the one that is 21% or 18%. You want to be smart. When students always used to say, oh, I don't want to study hard, I want to study smart, I always used to ask, how are you applying that? Because many students don't apply that principle, because you still see them struggling with content that are low area of the NCLEX exam, on the NCLEX exam. Because if you are studying smart, you need to study right from the highest percentage down to the lowest percentage. That way, you will cover what matters the most for the NCLEX exam, that give you the ability to pass the NCLEX exam in 85 questions. So that's the smartest way to go about it. So once you know each client need, know the content tested in each of the client need. Now, when you know that content, right? The NCLEX is like, okay, once you know the care that will be tested, there's only 6 ways nurses carry out care. So that's the 6 concept. So that is how the NCLEX can now see if you are a safe nurse. Through these 6 ways, okay, you are about to give this patient medication. So what way would you carry out this care? Is it related to therapeutic communication? Is it related to clinical judgment? Is it related to nursing process? Is it related to culture and spirituality? Is it related to communication and documentation? Is it related to teaching and learning? So you look at that question. When you see the question, you'll be able to identify, oh, this question will be related to this particular concept, and that will not be your thinking point related to answering that question. So that is how these 3 things work when it comes to the NCLEX. Now, so level 8 is your test taking strategy. That's your level 8, your test taking strategy. So test taking strategy, after you've completed all this, will now make sense. Right, so we are going to be on the same page. When we are applying a particular strategy, you will not see why that strategy work for that particular question. You will start seeing, like, everything will start making sense. You are not just going to be applying strategy in confusion. Because I've seen many students, when they apply a particular strategy, they're like, oh, I love this approach. Now, when they apply it to a particular question, they will get that question wrong and they will start blaming themselves. They will say, oh, I understand why I got this question wrong. I supposed to have thought about this. But what they should have thought about is not even related to that strategy. But because they saw you using the strategy, answer the question, automatically they feel you should answer this. So they start blaming themselves for what did not even, what was not the problem in the first place. Now, strategy does not mean you should not know your content. When you want to apply strategy, you apply the right strategy related to a particular content. When you miss out on that content, you will not even know if that strategy is applied to that question in the first place. Right. Generally, in the NCLEX word now, ABC is a strategy. But ABC is not a strategy. ABC is a nursing principle, and it's a principle of prioritization. It's related to prioritization. ABC is a principle, but now they have turned into strategy, because everybody says, oh, when you see a way, breathing problem, circulation, apply this strategy, ABC. ABC is a principle. It's not strategy, but now people call it a strategy. But still on still, you cannot apply it, if it's a strategy, to every question that involves airway, breathing, circulation. No, you cannot apply it. You cannot apply it. If they tell you you are in the pediatric ward and the patient is having, let's say you are dealing with newborn, and then they say the patient is having 32 respiratory rate, and then you are like, oh, respiratory rate, that is related to airway or breathing. Would you say this patient is having problem? No, because this is within their range. So you need to know that, oh, airway, breathing, circulation, this is pediatric and not adult. Or they tell you patient during labor is having respiratory rate of 26. Are you going to say, oh, because it's supposed to be 12 to 20, this is a problem? No, because you need to understand, during labor, there's high physical activity that causes the mother to breathe very fast. And after pregnancy, she will be fine. or they tell you a patient is having difficulty dyspnea related to exertion, would you say, oh, the dyspnea is related to airway or breathing? No, because you need to understand that the NCLEX stated that the dyspnea is related to exertion. All this patient need is to rest, and this patient will be fine. Right. So that is what we are trying to do when it comes to the strategy part for level 8, trying to make sure that you are able to apply strategy right. But in order to apply the strategy right, every other thing needs to be in place. Your ability to know the right content you are studying, your ability to practice the right question and have knowledge of those right questions, how to answer it. So now when we are applying the strategy, to now give you the fast ability to select the answer very, very fast. Right. Give you the ability to select the answer very, very fast. Now, level 9 is your readiness. This is the second readiness, exam readiness. At this point, you already know that you are ready. There are two things we do here. We try to revise and we try to fix what um, still have problem, and then you end up knowing that you are ready. So that's just what we do here. Right. So level 10, which is the last level, is your exam execution. This is where you are taking the exam. So what we do here, there are three things we do, right? I tell you what to do like 24 hours before your exam, the morning of your exam, and 1 hour before your exam. Right. So these are the three things we just put in place, right, for your exam execution. And then when you walk out as a license, licensed nurse. So this is the walkthrough of the 10 level roadmap to passing the NCLEX exam. Right. So this is just everything related to passing the NCLEX exam. Right. Now, like I said, let me just walk you through the program now. So this is what we are doing for, let me, hold on, let me take this off. I'm trying to take this off. Hold on. Right. So the program is a 60-day coaching program, right?
Okay.
And everything we are covering in the program is the 10 level, right? All true, right? Now the coaching investment is $497 for the 60-day coaching program. Now, the method of teaching for the program is related to uh, PDF or direct message, right? And question answering, right? PDF, direct message, question answering. So the PDF, I use it to communicate what you are doing each day, right? From each of those PDF lesson, right? You answer question related to it. Then you send the answers to those questions to me via WhatsApp, iMessage, yeah, whichever one, right? Then I'm going to review it. Now, this PDF is something that we teach you directly related to how to answer this question. Now, so from me reviewing the question you answered, right, I will understand what is still missing based on the knowledge that you should have like captured from this PDF, right? So from there, I'm not going to now try to explain as well too, right? I can use like a mini video explanation to explain, can use voice message to explain as well too, right? If there's still any form of difficulty, then I can now schedule a Zoom meeting, right? The Zoom meeting. So the Zoom meeting is PRN, right? in nursing is when needed, right? When necessary. Let me just say
Yeah.
when necessary, right? So the PDF is pretty much enough to like give you the best understanding because they are very clear, short, and they are straight target to this particular question, right? I'm talking about telling you when it's just like take for instance, I'm telling you something like when you see that the question is testing you related to labor, and then they are telling you no, one of the patient's respiratory rate is high, it's not consigning. And then you are seeing a particular question, and that question is telling you patient in labor is having respiratory rate of 26. Because this PDF said something like this already. So when you see this, you already know, oh, it's not consigning. You don't need to select the answer. Talking about whereby they ask you that a patient is having temperature of 97, and from the PDF I told you temperature normal range is 97 to 100.4, then you're going to say, oh, this is not bad, this is within normal range, right? So
Okay.
these are just pretty things, right? Because you've done all the too many information already in nursing school. Right now, we are only getting straight into the care. So I'm walking you through the care. So that is what we are doing. Right. So the PDF, this and that. So if I see there's difficulty with answering the question, still that's when we now go into like the we schedule a Zoom meeting and we end up meeting. Now, but for the 60 day, you are doing something every day. From day 1 to 60, you are doing something every day. Right. So yeah, most times I always used to like fix group Zoom meeting. I'm going to announce it, right? Whereby everybody can meet in group and then we like answer questions together, right? So I announce it, right? So there are two things. Some people will be able to make it to that group meeting, some people will not be able to make it. And that's why I always used to make sure that there's the recording for that Zoom meeting. I always used to make sure that there's a recording for the Zoom meeting, right? So that if you are unable to make it, you still have access to the recording, and also you still have access to asking me questions related to the recording. So far, so good. I've been doing this, and right, most of the time I don't even have questions. Like 98% of the time, I don't. People don't ask me questions because the Zoom meeting is like a conversation. Everybody are asking different questions in the Zoom already. So most likely the question you want to ask, somebody has already asked it, because it's not about the Zoom. It is not like whereby I just say, oh, what's the answer to this question? The answer is this, and we move on. No, I keep on asking the student, why do you say the answer is this? And also, like, let us say there is 4 options now, and then maybe people say the answer is 4. I will ask, why is the answer not this? Why is the answer not this? Why is the answer not this? And why do you say the answer is this? So if you were even planning before to ask, why was the answer not this? Maybe your answer was this. We have already covered why the answer is this, or why is the answer not this. So the chance of you having question will not, you will not really have question. Most question I even get is not even related to the question. It's just maybe students saying, okay, I saw you apply a particular strategy to this question. Can I still apply this kind of strategy to this question I saw right here? They send a particular question to me. I look at the question and say, oh, okay. Yeah, yeah, yeah. You are getting the principle. So yeah, something like that. So yeah, my goal is to guide you every day through what you are going to be doing, right? And making sure that you do them and be able to pass the exam successfully, right? Sometimes I can refer you to my school platform, whereby you can watch like some short videos related to like NCLEX tip, some things that you need to know. And all these NCLEX tip generally can give you 50% point, right, guaranteed to really help you pass the NCLEX exam. The goal of passing the NCLEX exam is not related to um the kind of question you will be getting, because nobody know the kind of question they will get, right? It's not like nursing school exam whereby once you go, you are trying to um answer nursing school exam question, you already know, like everybody have the same question. No, NCLEX, every student question are not the same. Every question are being asked based on that specific student knowledge. So it means that if somebody don't know much as this person, you still get the same question, that the kind of question that you can answer based on your knowledge. Right. So that is how the NCLEX work. So, but there is a guide that the NCLEX use in writing the question. So that guide, if I create a tip related to that guide for you and you study it, you like have that 50% chance of passing the exam already. So now, if you now put every other things that we have done in the program all together, which like you saw the level. So except if that student is not serious or they are not really doing what they need to do, trust me, the student have the ability to pass. Because if you observe the 10 level, right, even at the point of readiness, I'm still going to see if you have been truly doing what we need to do. Even when we are doing the content, you see, I say every day we do a particular PDF lesson and we do questions. So every day I will be seeing the problem and we are going to be fixing it. So there's no day that okay, you need to know something, there's no solution to the problem. There's always a solution to that problem. Except if you get tired of studying or you give up on becoming a nurse. The chance of you passing the exam is guaranteed. Let me share you a story real quick. Now there's a particular student, there are three in number that joined my program. Right, there are three in number. The first one joined, right, invited this other person and invited this other person. Right, I asked them for their test report. I saw their test report. Now this first student, that test report was not so good. I cannot remember which person test report was better in these two, but I know that this person know a content. This person struggle with the content but know much of the content than this other student. So if I am to say who is going to pass, right, I would likely say these two over this
Yeah.
person, right? Because based on what I have seen as the general knowledge. Now, when all of them were studying together because they joined, right, I noticed that this student improved even better than this person, right? And I was like, what's going on? This particular student had her own problem. Our problem is that she knew the content, but she don't know how to apply the content related to the question. That's a problem. But this particular student joined the program, started knowing her content, was able to apply it, but very slow in applying it. But I was expecting this student should be the one slow because you perform better than the student. So I was like trying to figure out what is going on. Right, couple of Zoom to make sure the students understand the concept, to make sure the student understand the concept. Not too many Zoom, but the student is understanding. Then when I try to find out what is going on, people will tell you what you want to hear. Now, like few weeks into the program, this student sent me a message and she was like, I have been so dishonest with you all this while, and I want to be honest. Truly, truly, I have not been studying. I am having issue with my mom, and it's been a lot for me, so I stopped studying for a while. Now you see, because I've seen the problem, I'm able to identify the problem. I'm like, if you are doing the same thing this person is doing, all of you should be understanding the same thing. All right. So what I'm really trying to say is that when I walk you through the program day by day, I know what you should have known. I know what you should know. And I know the problem you might have, and we are going to fix it. So, but if there's no fix, then there's always a problem. There's always a problem. The reason why there's no fix. Always a problem, the reason why there's no fix. This student took her exam, she passed, right? Even before these two that had better results than them. Right. Now, this student reached out to me and said she's going to take a break of this. Right. She took a break, she came back, she restarted, and then she also passed. This student has not yet taken her exam yet. So, but you see, the same chance of this student passing, this student have the same ability to pass. Even when at the beginning she did not started well, but at the end of the day, the result was passed, all by walking through this 10 level. Right. So if we do this 10 level right, you have the ability to pass. Like I said, except if you don't want to study again, or you've given up on becoming a nurse, right? So this is everything related to the coaching program, right? So I will enroll you into the program, right? Because many people tend to like pay the investment in full, and most students, right, due to financial issues, they tend to like use payment plan.